everyone, and welcome to Voices of Hope. I'm Ross Wilsey.
And I'm Mike Wade.
Each episode, we sit down to talk about what it means to live well, physically, emotionally, spiritually, and beyond.
We'll look at how wellness shapes us as individuals, families, communities, and even the wider world around us.
Through real stories and honest conversations, we'll explore what hope looks like and how it grows right here in the New River Valley.
Thanks for joining us. This is Voices of Hope.
Today we're joined by Brianna Bonat, who serves as the Director of Public Health and Engagement at the Virginia Cannabis Control Authority. Brianna's work focuses on making sure public health stays at the center of how cannabis policy and education show up in Virginia. She spent her career working in substance misuse prevention, and when she's not working, she's spoiling her dog Daisy or planning her next trip. Brianna Bonat, welcome to the Voices of Hope podcast. Well, Brianna, thank you so much for joining us on the Voices of Hope podcast. We'll start off just by asking you to share a little bit more about your background and how you got into this field.
Sure. I am born and raised in Virginia. I've been here my whole life. I grew up in Prince William County and then went to William and Mary for undergrad. That brought me to Williamsburg, Virginia. There, I got a bachelor's in kinesiology and health sciences, and I learned that public health exists because it wasn't anything that was talked about when I was a kid. And so learning that public health is a field, and with my growing interest in it, I concentrated in that in undergrad, which then led me to getting my master's in public health at Virginia Commonwealth University. And during my time there, I interned and did a contract position with Virginia Foundation for Healthy Youth. That really opened the door and got my foot in for state level work. And from there, I worked at Virginia ABC for a bit on their education and prevention programs. And then the CCA, the Cannabis Control Authority, emerged, and I had no idea what it was at the time. Turns out it was a new state agency, and I applied for a health policy analyst position originally, which 3.5 years later, I am here doing more public health and engagement-focused work now.
Well, it really is great to have you with us, Brianna, and we're going to come back and talk more about the Cannabis Control Authority. But the topic of the conversation today is one that seems to be ever-changing with lots of layers and nuance. So let's set a baseline for our listeners. We're going to be discussing cannabis. Can you give a general overview of what that is exactly?
Sure, of course. So at its basic level, cannabis is a plant. And that plant contains a number of compounds known as cannabinoids. And I think the two most common cannabinoids we hear about are THC, which produces that feeling of being high. And then you have CBD, which is non-intoxicating, and it's commonly used for wellness applications. Both hemp and marijuana, which is also known as cannabis, both those types of products come from the plant. Hemp contains less than 0.3% THC, and it's cultivated for a number of reasons. You can make ropes out of it, you can make paper, bath washes. It has a lot of industrial purposes, but people also cultivate it for its CBD content. Versus cannabis has 0.3% THC or more. And then in Virginia, we have two different agencies kind of overseeing the plant. So hemp and hemp-derived products are regulated by the Department of Agriculture, whereas the medical cannabis program in Virginia is regulated by us at the CCA.
Okay, thank you.
Okay, so back to the Cannabis Control Authority here in Virginia. Can you share a little bit about that organization and what its purpose is?
Yes, of course. So we are a pretty new state agency, like I think I mentioned. We were established by the 2021 General Assembly, and we hired first staff in 2022. And then we took over the regulatory oversight of the state's medical cannabis program in January 2024. So very new, but definitely experts in our field. And overall, we are an independent political subdivision of the Commonwealth. And our mission really is to promote public safety, advance public health, and protect our communities. And we do that through balanced and inclusive cannabis regulation, policy, and education. So we oversee the medical cannabis program regulations, like I said, but if there was a retail market, that will likely fall under us as well.
Okay.
Gotcha.
And we're going to come back and talk about the medical marijuana piece of all this in just a bit. But let's kind of talk about sort of the general lay of the land when it comes to cannabis being legal in Virginia, as it currently is in many other states. There are laws to abide by, of course. But I do think it's fair to say that there's still a lot of confusion, or at least a lack of understanding about what is legal and what isn't. Can you dive into that a little bit?
Yes, I always start off presentations about the laws by saying the laws are confusing, and then we dive into why. So, to go over in general what's legal for our state when it comes to cannabis, I've mentioned the medical cannabis program a lot, but it is legal in our state, medical cannabis that is sold by a licensed dispensary. And in addition, the possession of cannabis for personal use in your private residence, if you're 21 or older, is legal. You can also publicly possess up to an ounce for personal use if you are 21 and older. And to stay on the theme of 21 and older, home cultivation is legal for those who are of age. You can cultivate up to 4 plants in your home, your private personal residence. And then adult sharing of up to 1 ounce between people who are 21 and older is legal as well. However, I say they're confusing the laws because there's currently no legal way outside of the medical cannabis program to purchase cannabis or seeds. So that's where the confusion comes in, because you can grow if you're 21 and older and you can possess cannabis as well, but you can't just go to a shop and buy it if you're not part of the medical program. So confusing laws there, but those are the ones that exist. And then in addition to other laws, things that are illegal pretty much are the opposite of what I just said was legal. So if you're under 21, no cannabis possession, consumption is allowed. If you possess more than 1 ounce in public or you're growing more than 4 plants, that's illegal. And then in addition, driving under the influence of cannabis is illegal. And then there are also open container laws. So the open container laws apply to both the driver and the passenger, but there isn't allowed to be an open container of cannabis that's accessible in the passenger area of a vehicle. And then to just add on to it, if you'll indulge me, we also have confusion because we have federal illegalities in addition to our state laws. And so it's important to keep in mind too, just because we have some legalities in the state, if you are doing things like mailing, shipping, traveling interstate, flying with cannabis, all of those are going to be illegal. So anything that's involving federal land, federal space, federal regulations will be illegal.
Okay.
That is a lot to take in for sure.
Yeah. And so the CCA, though, is not in charge of enforcing these laws. Is that correct?
That is correct. So that'll be state law enforcement, local law enforcement who will enforce those.
Okay. So we're recording this episode in December of 2025, and Virginia is on the verge of making retail sales of cannabis legal beginning in 2026, if I'm correct. If the General Assembly approves it, what are the pros and the cons of establishing a legalized retail market for cannabis?
Sure. I think pros and cons, so to speak, they're often debated. But the CCA does stand ready to implement whatever the General Assembly passes. That stands true every year, no matter what laws are being debated. And so I will say that we know that there is an illicit cannabis market that exists. And when we think about the laws and how you can possess, but you can't legally purchase outside of the medical program. Bringing in that retail market does provide regulations that could damper the illicit market, but then also help ensure that those who are choosing to possess or consume ensure that they have tested products in a way that is regulated, that is being overseen by a bigger entity. And then I think many cons stem from the concerns that people have with public health and safety when it comes to the retail space, especially when we think about the youth. So with that, I do want to say that not only is the CCA ready to implement whatever the General Assembly passes, but we also want to do that with our mission in mind. So we want to continue advancing public health and promoting public safety, and we want to make sure we're working with communities and working with our stakeholders to make sure that whatever transition, if a transition were to happen to a retail market, that we do that in the best way possible, keeping those items in mind.
And the target for that legal retail market would take effect, I think it's in November of 2026. Is that correct?
That is the current drafted bill. But
Okay.
session starts in January and things could change.
Absolutely. Yeah. And when it comes to cannabis, we're not just talking about rolling joints these days, obviously. Cannabis can be consumed in lots of different forms, from edibles and gummies to energy drinks. Aside from the increased availability and access to these products, those of us who work in the world of prevention and public health are also concerned about, obviously, the high potency of THC in them, which you've touched upon THC already. But for our listeners who aren't familiar with that, can you talk about THC and why it's such a concern?
Sure. THC, like I said at the beginning, is a compound that you can find in cannabis, and it is what causes that feeling of being high.
Mm-hmm.
And it's definitely true that there are higher concentrations of THC products that exist now versus before. And it is a public health concern that many do cite. Higher concentrations of THC can pose greater risks for overconsumption, for dependency, as well as other health concerns, especially when we think about the youth and the developing brain and that nature they have to potentially explore cannabis. However, to kind of flip the coin on its head, I do want to also acknowledge that there are cannabis users out there that do express benefit from having higher concentrated products available to them, especially in the medical space. So what we definitely want to focus on in the public health space as the CCA as well is that education piece, right? Because these products exist. We can't snap our fingers and get rid of them, but it's about approaching cannabis in a responsible way if you're 21 and older, ideally going slow, using a lower concentration first, reading your labels, and then ideally, if you're underage, not using at all. But if you are, make sure we're exploring responsibly.
So thinking a little bit more specifically about medical cannabis or medical marijuana, I feel like there can still be a lot of confusion about the regulations around that. Can you do anything to kind of help us clear that up a bit?
Yeah, I am happy to describe what the program is in Virginia. Of states that have medical cannabis programs, each one is run a bit differently. There is no uniform way for a medical program to exist. In Virginia, there's 5 health service areas or regions, and each region can have one processor license that is vertically integrated. So on that one site, they are doing everything from cultivating to dispensing. And then in addition, that processor can have up to 5 additional dispensing licensed locations. And they can have 1 additional cultivation site license. And within the state, there are currently 24 facilities across all of those types. looking at the patient side of things, where most of our medical cannabis program stakeholders lie, or are interested in, I should say. In order to be a patient in Virginia, you do have to be a resident in Virginia, and that can be permanently or temporarily. You have to be at least 18 years of age or older. And so that's something to note, that it is actually 18. It's not 21 like with tobacco or alcohol. But tobacco and alcohol also don't have medical programs like
Right.
cannabis does. So there's some comparison there. But in addition to those requirements, you also have to have a valid government-issued ID and have a condition that may benefit from cannabis use. And so Virginia doesn't specify what conditions qualify patients for medical cannabis, but rather that is up to the medical practitioner that patient is working with to decide whether cannabis is right for the patient. And so assuming a patient meets those qualifications, they will meet with a medical practitioner, and that practitioner will go over their symptoms, medical history, are they using other medications, things like that, to help determine if medical cannabis is right for them. And if that practitioner decides medical cannabis is right for them, they will then issue a digital written certification. And that certification, once a patient has that, they take that and their valid government-issued ID to a licensed dispensary. And from there, they can work with the pharmacist on duty, other staff at that licensed dispensary to further find products that are right for them. And important to note, too, that parents and legal guardians, as well as caretakers, can go through this process on behalf of a child or a vulnerable adult as well.
Well, Brianna, we had the good fortune of having you present to one of our local coalitions here in the New River Valley recently, and one of the things that you touched upon in your presentation was the Cannabis Control Authority's focus on prevention of impaired driving, which you've also touched upon a little bit already, but could you talk a little bit more about that initiative?
Yes, our Safe Driving initiative is one that I have had the pleasure of working on for the last several years. It's definitely a topic of interest because a lot of the data we've collected is of concern. And so our initial safe driving campaign was conducted in 2022, and that was in response at first to the General Assembly and them asking us to produce a campaign. But we decided to continue prioritizing education on safe driving because from our own data, we see there's a lot more work to be done. So for example, in our 2024 statewide impaired driving survey, there were several concerning results, including that 30% of Virginia drivers said that those who consume cannabis and drive are slower, cautious, safer drivers. And then looking at the actual behavior, this is all self-reported data as well, but 35% of past 3-month users said that they drive under the influence of cannabis at least once a week. So we're seeing over a third of past 3-month users, more frequent users, who are self-admitting that they not only have driven under the influence, but that they're doing it pretty regularly.
Well,
And of course, it's not only illegal, but it's definitely unsafe. And so we are running several years now worth of campaign materials to hopefully mitigate that behavior and try to get these results down before they skyrocket too much. We currently have radio ads that are running, and we plan to have a new campaign out there, and that'll start early February is the goal. But that'll be a robust campaign on all types of media to spread the message of the legal and safety consequences of driving while high. And so in addition to a multimedia platform, we will also have campaign materials for community groups and other stakeholders to use, because we recognize if we're the only voice, if the CCA is the only voice out there spreading the word, it'll take a lot longer to see behavior change. And we want this to be something that we all get behind. I think we all can support safe driving. And so we will have campaign materials like social media posts and things like that community groups can use as well to help spread that message and promote positive societal change.
That's great. Well, I know we look forward to sharing those materials once they're available.
Thank you.
We're getting close to the end, but for listeners who want to learn more about the Virginia Cannabis Control Authority, where might they be able to find you?
You can find us in a number of places. Like I said, we're a pretty new agency, so if you haven't heard of us, please take a moment and explore our website especially. Our website is cca.virginia.gov, and you can find a number of items on our website, including information on laws, on the medical cannabis program, and our educational resources. And then if you go under our contact page on the website, you can actually order our printed resources and we'll ship them straight to you for free. We also have a data request form on that contact page. And similar to our educational resource order form, we will happily take our statewide data and drill that down to data for your community of interest, whether that is by location, by age group. Let us know, and we are happy to drill that information down to the population you're concerned about. And we also do plenty of speaking engagements as well. So you'll find a speaker request form. We love a presentation. We love webinars. Here I am on a podcast. We'll do exhibit tabling as well. So if you have an event that could benefit from the CCI being there or vice versa, please let us know. You can also find us on social media, so Instagram, Facebook, X, and LinkedIn.
Wow. Yeah, it seems like y'all have thought about just about everything, and that's great. I mean, I just think it's so important that we're having this conversation more publicly more often, so...
And I can vouch because I've bugged Brianna and her team quite a few times over the last couple of months. They're also very responsive when you make requests and reach out to them. So don't hesitate to do that.
I appreciate that.
Sure. Well, one more question before we let you go. Any final words of wisdom to share with our listeners?
Final words of wisdom on any topic?
Any topic. The floor is yours.
The floor is mine. Maybe it's because it's the holiday season, the season of giving. But something I had been thinking a lot about, both professionally and personally, is like we work in spaces where we're public servants. We give a lot to others. We give to our communities and we support so many various groups of people. But with all the giving that we do, I guess my words of wisdom will be to make sure we're giving back to ourselves as well.
Yeah.
I think it's hard to constantly give when our tanks are empty. So take a moment and refuel. And that could be taking a walk, making your favorite meal. For me, sometimes it's just by doing absolutely nothing and sitting on the couch for a bit. But yeah, definitely take a moment and allow you to be you, and that'll allow you to continue to do the great work you're doing for others.
Well, those are indeed some wise words that you just shared. Yeah.
Thank you.
Thank you so much, Brianna. It's been great having you.
Of course. Thank you.
Take care. Thanks for listening to Voices of Hope.
If you enjoyed today's conversation, we'd love for you to rate and review the podcast and help us spread the word.
Voices of Hope is a production of New River Valley Community Services.
To learn more or listen to past episodes, visit nrvcs.org/podcast.
And remember, hope grows when we share it.
So keep the conversation going, and we'll talk to you next time on Voices of Hope.